All right, welcome to our viewers. This is Elizabeth Mercero, nutritionist, and this is the first of many Q&A style vlogs that you'll have coming to you from our team of experts. And today we have the pleasure of interviewing Dr. Chad Larson, naturopathic doctor. We're going to be talking about a very important topic today, and this is a unique time that we are all in, sheltering in place during COVID-19. And I know that both of us in practice have been talking to clients, for you patients, regarding COVID-19, and really you're having a unique hands-on experience right now as your patient population is very much at risk for COVID-19. I know that that's sort of what you've been working with. So I'm excited to hear more from you on this topic. So Dr. Chad, welcome again.
Thanks. This will be fun.
Yeah, so tell us a little bit about what you're seeing in practice these days.
Well, the thing that concerns me most that I'm seeing in practice, which is just kind of a slice of the population that's out there, and that's a lot of metabolic syndrome. So metabolic syndrome I call the most important condition that you've never heard of, because it's a set of symptoms that are very, very common. And when they're put together, there's sort of 5 criteria that I'm sure we'll go over, that all you need is 3 out of the 5 criteria, and you're considered to have metabolic syndrome. And with what everybody's concerned about right now with COVID-19 and what's going on with their immune system and what they can do to decrease their chance if they got a virus, how that would kind of progress in their body, is very much influenced by whether or not somebody is metabolically fit or not fit. Mm-hmm. And this is what a lot of people are hearing things about, like a cytokine storm, and like, what does that mean, and how does that fit in, and how can a person prevent that? And so, yeah, metabolic syndrome is something that I'm evaluating on every patient. And if somebody is found to have metabolic syndrome, I am helping them to understand what that means in their system, and then work on how can we mitigate that problem so that they don't have this major risk factor. Fortunately, what you and I have talked about with our patients for a long time, it's in conditions, how one set of symptoms could predispose you to another set of symptoms or a whole other condition. Now everybody's talking about that, how all these people with pre-existing conditions are at a greater risk of having a worsening, COVID-19 sort of process.
Mm-hmm. So before we go any further, can you really define metabolic syndrome for us? Tell us what it is.
Yeah, metabolic syndrome is a diagnosis that's made from 5 different criteria. And those criteria are elevated blood pressure, elevated blood sugar, elevated triglycerides, low HDL cholesterol, and a waist circumference above 40 in men and above 35 in women. And all you need is 3 out of 5 of those criteria, and you're considered to have metabolic syndrome. And so this is super simple evaluation. All you need is, every lab test that you've had, or if you haven't had one recently, you should get one, just a basic lipid panel, which is like the cholesterol, triglycerides, HDL, LDL. That'll give you that component. And then you just need your blood pressure and a simple tape measure of your waist circumference. And you have the evaluation of all 5 of those criteria. And if you have 3, you have metabolic syndrome, and you need to seek the right kind of provider to help you mitigate that.
Wow. So those criteria that you just mentioned are really what we've been seeing sort of at the front of the headlines for people that are at risk.
Absolutely. Yeah, the people who have worsening consequences from coronavirus are those who have diabetes, obesity, heart disease, these kind of underlying conditions where there's so much metabolic dysregulation that leads to immune system dysregulation, and they've got an imbalanced immune system. So basically, I call it, they become a susceptible host to the opportunistic pathogens that are out there, including viruses. So when somebody is a susceptible host, then they're likely to have a worsening response to getting something like a pathogen, because their immune system is imbalanced. And so it's going to have an abnormal, imbalanced kind of reaction to these opportunistic pathogens.
Wow. And those are so common. I feel like as soon as you turn on the TV or on the radio for one minute, you'll hear an advertisement for medications to sort of help with these imbalances, right? Whether it's high cholesterol or high blood pressure. And it's also what we're seeing all over the news in terms of those are the people at risk. So it's so common, but how common is it? Like, is it above 50% of the population, or what are the statistics there?
Well, so far the statistics from multiple research studies is that metabolic syndrome, so in other words, 3 out of the 5 of those criteria, if you're over 50, you have nearly a 1 in 2 chance, a 50% chance of having it. If you're under 50, you have about a 25 to 30% chance of having it. So that's an extremely high percentage of the population. But there's another study on just what they call metabolic fitness, like what percentage of the population is metabolically fit. I'd have to look back at the criteria. It's a lot of the same ones, but it might have just been, you don't have to have 3 out of the 5, it might have just been 1. And the statistic is 87% of the population is metabolically unfit. There's only a little over 12% are metabolically fit. So those are abysmal statistics. And it's not surprising that the US has had a really difficult time with coronavirus. I mean, it could have been predicted just from a susceptible host kind of standpoint. There's such a huge percentage of the adult population that are metabolically unfit. Mm-hmm. And so their immune system has this type of imbalance, and they're much more prone to this kind of worsening situation.
Yeah, absolutely. I mean, I see as a nutritionist, the vast majority of the clients that I'm working with are coming in, doing their first appointment, and they're presenting with at least one of these, that you're talking about, these criteria. So I'm definitely working with the population that is, this metabolic syndrome condition. So how is this typically treated in sort of conventional medicine? I know that people have sort of been on a journey by the time that they come to you. How is it typically treated?
Yeah, I'm glad you asked that question, because I was reminded of that when you're talking about common commercials that we see for all these different things. And that's the way that it's being ingrained in people, is the way it has to be treated. If you have high blood pressure, you need this medication. If you have diabetes, you need this medication. It's all about the emphasis is put on what medication a person needs, and not at all on what the person needs to do with their body to improve their condition. So it's very much each of those components of what we call metabolic syndrome are just treated as an isolated issue. It's not looked at like, okay, it's not just a heart or blood pressure, cardiovascular problem. Their whole body has metabolic syndrome. Mm-hmm. But it happens to be on that particular individual, the thing that is the biggest problem is a high blood pressure. So they put on high blood pressure medication, which will artificially, suppress their blood pressure, which in cases is very important to control blood pressure that is out of control. But we also, at the same time, want to start working on the body-wide dysfunction in their metabolism. Mm-hmm. And so that's where the real treatment needs to be, is we have to fix, because guess what? Their gastrointestinal tract, their immune system, their hormonal system, it all has metabolic syndrome. It is all metabolically unfit. And if we just have tunnel vision on just, say, their blood pressure or whatever the individual's case might be, they might just have obesity, or they might just have diabetes. If we just have tunnel vision on just that problem, we're going to miss this issue with all these other organ systems. And we know this statistically, because if a person has one of these conditions like obesity, we know it massively increases their risk factor for heart disease and certain types of cancer and diabetes and these kind of things. So it's important that the whole system is taken into account, and not just have tunnel vision on just whatever brought them into the office.
Mm-hmm. Yeah, I mean, I see that as well. So it's just to take your example in terms of blood pressure, when the patients are coming to me with blood pressure, I know as a nutritionist, like, okay, it's not just blood pressure that we need to be working with. We need to be addressing blood sugar imbalances and, stress management, and really sort of looking at them from a holistic standpoint, because it is so intertwined, as you're saying.
Yeah, what we're creating is basically a spectrum of metabolic syndrome, because there's kind of like 4 stages, or 4 sort of, let's call them stages of metabolic syndrome, where let's say stage 1 is the person doesn't have metabolic syndrome. They don't have 3 out of the 5 criteria. In fact, in stage 1, we'd say that they don't have any of the criteria. They have 0. But if let's say if their waist circumference is 38 or 39, but not 40, or their blood pressure is high normal, but not actually elevated, or their blood sugar is 99, but it's not 105, like, are we just going to ignore them and say, oh, you're just fine? No, they're in stage 1, and they have some criteria that are getting very close to being out of range. That has a certain set of kind of clinical management. And then stage 2 is they have 1 to 2 of the criteria. So again, they're not considered to have metabolic syndrome, but they have some issues already. They have maybe obesity, and maybe they have high blood pressure. So they only have 2. They don't have metabolic syndrome, so they can't be ignored. But yet it's a little bit higher than stage 1. So that has a certain set of criteria, that symptoms and treatments that we want to evaluate. And then, of course, stage 3 is metabolic syndrome. Stage 4 is they've actually developed a full-blown pathology, like they actually have diagnosable diabetes, or they have diagnosable heart disease. And that comes with a different set of ways that we want to look at it. And then within kind of the staging, there's different types. Like some are more predominant with abdominal obesity. Some are more predominant with blood sugar dysregulation. Some people are more predominant with high blood pressure. And so this is where some individuality takes place, and we can't treat all people with metabolic syndrome the same way. We have to kind of tailor it and individualize it to what their metabolic needs are.
Absolutely. It's so interesting, and it's so important for people to hear this, because by the time that people are coming in to see one of us, I don't think that they've even heard the term metabolic syndrome prior to that.
No, they haven't.
Yeah. So often I feel like, I'm sure you experience this all the time, where when you're talking to patients and sort of talking about their entire health picture, that they have like a lot of aha moments where they're like, aha, okay, because we're sort of connecting these pieces together for them.
Yeah. And they oftentimes ask me, like, why haven't I heard this before? I've been to XYZ doctors. Nobody said that I had this metabolic syndrome. I've never even heard of that before. Why is that? Because what, let's say, a pharmaceutical-based doctor, the way that they would address this is they'd have to figure out, okay, you have high blood pressure, so we have to treat your blood pressure. Oh, you also have diabetes too? Okay, here are the medications that we do to manage diabetes. It's all about just individual management of each of those things that, to me, are kind of, and not just to me, but to the people that came up with, this syndrome of metabolic syndrome, that it's all one big component. It's metabolic dysregulation, and it's just manifesting in different people in different ways. But yeah, I'm asked that all the time. Like, why didn't my doctor tell me this? And I just have to say, I don't know. I have no idea why they didn't tell you, but it's out there in the medical literature, and it's not something that I'm making up. It's something that has been around. It's been a defined condition for decades.
Defined and extremely common condition. So why would metabolic syndrome affect the immune system?
Yeah, that's a timely, question, because it does majorly. The immune system is connected to the rest of the body. So if there's dysregulation of, let's say, your blood sugar metabolism, then that's going to absolutely influence the health of your immune system. Your immune system is very vulnerable to imbalances in other parts of the body, like the gastrointestinal tract. Like 70% of your immune system lives around your GI tract. So it doesn't take a scientist to realize, okay, if it's right there living with the GI tract, don't we think that the health of the GI tract will influence the health of that component of the immune system? And of course it does. Most people hopefully most, have been familiar now with the gut microbiome, or just the importance of the balance of the gut bacteria. If you haven't, it's something that is just a key component to just general health and wellness, is the integrity of our gut microbiome. And there's lots of ways to evaluate it and treat it. And that's not really the purpose of this conversation. But the idea is that the immune system is very dependent upon the health of the rest of the body. Mm-hmm. And if there's imbalances, metabolic syndrome, then it's going to influence everything else. There's a fancy term for this. It's called immunophenotyping. Immunophenotyping is basically what is the phenotypic expression. Basically, when you look at yourself in the mirror, you see your phenotype. Your phenotype are the genetic variables that are being expressed to make you who you are. And there's lots of different stories that your genes can tell. We call that your genotype. Your genotype has a whole bunch of different stories that it can tell about the function of your heart or your liver or, your skin or whatever. But what is actually manifested is called the phenotype. And so this could be drilled down to different organ systems. And so the immune system has this process of immunophenotyping. And we know that everything that's in our environment, including the foods that we choose, the lifestyle that we lead, is very, very much influences our immunophenotype. So everything that we're exposed to and the things that we consume, from food and beverage and just other things, very much directly influence the phenotype and the health of our immune system.
Mm-hmm. So food and lifestyle does influence the immune system. I feel like there isn't really, we aren't hearing about that right now, except for from our community, right? Like in the news, when you turn on the news or start reading articles, yes, there's all of these measures in place in terms of that are very, very important for stopping the spread of the virus, in terms of social distancing and washing your hands and wearing masks. But really, from the World Health Organization and the CDC, we're really not seeing a lot of literature or guidance on these other places that we can make a huge difference in our immune system, including, diet, nutrition, and lifestyle. And those have a huge, just like what you're saying, that has a huge impact on the way that our immune system is going to react.
Honestly, it's mind-boggling, the lack of information in this regard. It's all about the virus. The only responsibility that we have as individuals is just staying away from each other, so the virus has less of a chance to hop from one person to another. But even that is still sort of virus-based. And there's not any information or emphasis about the health of the host. And there's just a ridiculous amount of literature that emphasizes or teaches us that we are very much in control of the health of our immune system. Mm-hmm. But you listen to just the regular news and just kind of the mainstream information that's available. It's all about the public health kind of aspect of it, which, like you said, is totally important. It's really important to kind of starve out the virus so it doesn't have so many opportunities to infect yet another host. But it's so much more nuanced than this. It's so much more valuable to realize that we actually have some control over how our bodies respond to these kind of viruses. And for some reason, it's just not being discussed. So this is a good pivot, I think, for us to have some opportunity to explain to people how in control, and then even specifically what they can do to improve their own particular immune system. So I don't know if you had a particular question about that, or you just want me to kind of roll into it. But yeah,
we can just roll into it. I think now is a great time for us to sort of talk about some action steps that they can take, that our viewers can really start putting into action today.
Cool, because this is the fun stuff. This is stuff that me and you do all day long with our patients and clients, and it works, and we can make changes pretty darn quickly. And it's fun to do because it empowers people. People right now are so stressed because of the lack of control that they feel that they have. They actually have a lot more control than they think they do, but it's the sort of artificial lack of control. It's super stressful for humans. We like to have some sense of control over our environment. In fact, just as a sidebar, that's why like things like hoarding, all these people were so frustrated with people that hoarded like toilet paper, and they like went all these different, that's a totally like just normal human reaction to like hoard stuff. So just from that perspective, it makes it a little less annoying that people did that, because it's just a human reaction. But at any rate, it's a control thing. We wanted to be in some control of something, but people weren't educated on what kind of things you can actually do to put yourself back in the driver's seat of how your body responds to things. And so just something so simple as being conscious about the dietary food choices that you're making could have a massive impact on your immune system, not just from the point of health of your gut microbiome, but that's a huge one, but also just the phytonutrients, all the nutrients that you're getting in. Just been no information about the importance of just basic nutrients like vitamin A and vitamin D and vitamin C and zinc and selenium, things that are just common parts of our conversation with our patients. Nobody's talking about it, and it's just mind-boggling to me. So yeah, diet is definitely one of the major components. We know that just a fairly moderate amount of sugar by sugar, I don't mean, of course I mean straight up sugar from like sweets and stuff, but also processed carbohydrates turn into sugar very quickly in your system. That causes your immune system, your neutrophils, to just suppress very, very quickly. And that can stay suppressed for hours. In studies, when they looked at this, they stopped at like 5 hours, and the immune system was still suppressed at that point. So talk about a susceptible host. This is just one thing that we're talking about so far. Can suppress your immune system. If you're exposed to whatever viruses might be out there, you're a major susceptible host at that point. So if we can string together more and more of these things that we'll talk more about, then we can really help to bolster our system.
Absolutely. And if that person then has sugar again and again, it's suppressing the immune system over and over again throughout the day. So you do become more of a susceptible host in your terms. Okay, so if we were talking about sort of like the top 3 recommendations that you were giving your patients right now to really support the healthy immune system and reduce the chances of becoming sort of an infected host. So you're saying those vitamins that you just mentioned, and then diet. And I think we should definitely go into some more tips about diet, because I love talking about that. And then what would the third recommendation be, that you're really giving most of your patients right now?
It's got to be the focus on sleep. There's no better like Swiss Army knife for health in your immune system than sleep. It's ridiculous what happens to your immune system. On the upside, when you get good sleep, it's just one component that I'll mention called NK cells, or natural killer cells. Natural killer cells really help to keep your cells healthy. And if they get infected with like a virus, the NK cells help to take care of that very quickly. They destroy it. They're like the special forces military of your immune system. And they go and they get rid of the bad guys that have infiltrated your cells to keep them from replicating and really taking a deeper dive into your system. So that's just one thing. And sleep does, like I said, I stole that term from a sleep specialist named Matthew Walker, the fact that sleep is such a Swiss Army knife for our general health and immune system. It's, so many other inflammatory components. And there are certain inflammatory components that this whole cytokine storm that we talk about, when we get infected with a pathogen like a virus, it's the immune system's response that lead to a lot of our symptoms, as opposed to the bug itself. It's our immune system's response to it. Some people who have this dysregulated, imbalanced immune system, who already have one of these underlying conditions, they can have a really hyperactive inflammatory response. And that's the cytokine storm that can really cause the infiltration into the lungs and get all the inflammatory lung and kind of lower respiratory system advancement of symptoms. And sleep is just fantastic. But within the context of sleep, we have to think about, okay, we know sleep is good. For adults, they should be getting 7 to 9 hours. For, if you have kids over 10, years old and into teenage years, they should be getting like, 9 to 12 hours of sleep. And so, but that's on the upside. That's what can happen if we get sleep right. But there's lots of things that throw our sleep off. And so many people are sort of comfort eating and comfort drinking. And we know that just slightly, wrong foods, especially foods that are eaten too late and foods that are higher in sort of sugars and processed carbohydrates. And then we know that alcohol, all those things could disrupt your sleep. So one of the things that we have that are so important for supporting our immune system could be disrupted by making, just a little bit wrong choice there.
Absolutely. And in addition to diet really affecting sleep quality, also sort of the lifestyle that is created with the shelter in place, and not for everybody, but I know that, a lot of the clients that I've been talking to, they're just, we're sort of indoors a lot more than we were previously. And that's really sort of negatively affecting the circadian rhythms, because we need sunlight in the morning and bright light. And those UV rays coming into our eyes and connecting to our brain, so that the body can know that this is the awake hours. And then sort of on 12 hours later from that, okay, this is now the time that the body needs to calm down and get ready to rest and digest and sort of repair what you're talking about in terms of boosting the immune system from that reparative sleep. So some additional sort of points there is, do your best to get bright light in the morning, to get bright light, whether you're walking out on your patio and drinking a cup of coffee there, or just opening a window and sitting by the window if you can have sunlight coming in, really sort of having some light exposure in the first part of the day. And then in the evening, even though, we know that Netflix and sort of TV watching is everybody's doing right now, because we're sort of trying to escape into a different world, right? A different reality. And really creating a curfew for when you're cutting off screen time, right? At nighttime. In the evening, having a screen curfew, because those artificial lights can really affect your circadian rhythm.
Yep. And also eating late at night. So for that, around that same cutoff time for screen time would also be a good time to cut off. Oftentimes there could be snacking. If you're just up later, oftentimes snacking happens. And we know that, let's say about 50% of the adult population eat in a 15-hour eating window per day. So pretty much just like the sleep at night is the only time that we're not eating. And we know that has lots of effects on this day-night circadian rhythm that you're talking about. So if people, when the screen time shuts down, they should also be staying away from any kind of food consumption, because if food is eaten, we know that food in the stomach is not going to allow the body and the brain to go into those deeper levels of sleep that are so restorative and reparative and supportive for the immune system, because they're stuck trying to digest food. And people who have eaten late have probably had that experience, like, oh, it took me a long time to fall asleep because my stomach just didn't feel right laying down. So it should be like 2 to 3 hours before bedtime. There should be no other consumption of food. Another good way to look at it is, from whatever time you have your first meal of the day, try to just count about 10 hours, and you should try to consume your foods within that 10-hour time period. So if your first meal is at 8 in the morning, so 8 at night would be 12. So you just subtract 2. So you go, 12 hours later would be, 8 p.m. at night. So you subtract 2, so 6 o'clock. So you could shift whatever time frame you want, but we know from some really good literature that a major way to support this circadian rhythm that we know supports your immune system is eating within a certain time frame. The what and the when of our food choices have a lot of control on the circadian rhythm and the quality of our sleep.
Absolutely. And this is that concept of time restricted eating. And I know that with so many of my clients with metabolic syndrome, we're constantly talking about having an open and closed hours for your kitchen. Like, okay, at a certain time in the morning, the kitchen is open, that's when you can start your first meal of the day. And then actually having a very clear cutoff in the evening with kitchen is closed. And so many of my clients are excited by that idea because it sort of puts, we like to have framework, we like to have guidelines, and this is a guideline that can be really supportive of creating a healthy circadian rhythm and therefore creating deep sleep to support the immune system. But that concept of kitchen closed and kitchen open hours is, I love to do that in my own household, just in terms of like, okay, the mess is cleaned up. Now I'm not even going to address that. I'm not going to make another mess. Nobody's going to make another mess in the kitchen until tomorrow. So it's a win-win, but wonderful. So it's for the top 3 recommendations. I just want to sort of summarize those again. It's the vitamins of, will you name the vitamins again?
Yeah, and we could talk about supplementing the vitamins, but we're also saying just getting, eating foods that are rich in these vitamins, and that's your wheelhouse, and you feel welcome to go into those. But, vitamin A, I think, is a very underappreciated nutrient for immune support. It's fantastic. Vitamin D, vitamin C, zinc, selenium. Those are just really common ones that have direct influence on the health of our immune systems.
Exactly. So it's the minerals are also, the minerals, zinc and selenium are so important. I'm having everybody eating 4 Brazil nuts a day, just having that nice food source of selenium coming in to provide the body with minerals, protect the thyroid, and eating quality protein when it's available to really get the other minerals that we're after here. And then vitamin A, we find it in things in a lot of our orange vegetables, right? And also in our organ meats, things like liver. And then vitamin D, egg yolks, right? This chicken skin. And then, we're just eating as many real foods as possible will really help to provide the body with these micronutrients.
And that sunshine that you're talking about getting in the morning hours, there's a great source and key source of vitamin D as well.
Absolutely.
But yeah, because by getting it in food sources, and I'm a big fan of supplements. I have formulated supplements. I recommend supplements in a targeted way to patients frequently. Mm-hmm. But and I'm a fan of certain multivitamins, that really high quality multivitamins even, but you're only going to get exactly what's on the label. And when we consume a food, even if it's some of the foods that you talked about that really feature vitamin A or that feature selenium, there's a whole bunch of other nutrients that you're also getting, some of which we don't even have a name for. Mm-hmm. Generally, we call these phytonutrients. Phyto basically means plant, and nutrients means nutrients. And so there's all these unnamed, many of them are named, but some of them are unnamed nutrients that are amazing for our immune systems. And I think we probably, I don't want to say failed, but we missed out on something. I think whoever, the early nutritionists who did a brilliant job of identifying vitamins and naming them and coming up with like an RDA, a recommended daily allowance that you should have for these nutrients. Like, that's all amazing science. But at the same time, I think we missed out on the importance of emphasizing these phytonutrients. In fact, I think some people are phytonutrient deficient. It's like, we just don't have a name for it. We don't have a way of quantifying it. But just by looking at people's diets, you do diaries on people all the time, and you'll see foods that are just like totally missing from their diet that are so rich in these phytonutrients that they're just not getting, which is it just coincidence that they also have one of these metabolic syndrome criteria? Maybe some of these metabolic syndrome criteria are actually phytonutrient deficiency symptoms, because they're just not getting these proper nutrients. And so really emphasizing these healthy whole foods, lots of great, plant foods, plant-rich diet. You and I aren't super into a plant-only diet, but we do like to emphasize a plant-rich diet. We talk about healthy animal proteins with our patients, but having the richness of phytonutrients in the diet we think is totally at the top of the list.
Absolutely. Phytonutrients, antioxidants, and yeah, eating plants as often as possible, and brightly colored plants will provide fiber, or those micronutrients that you're talking about, the phytonutrients, antioxidants. I mean, these are just wonderful powerhouse foods that we need to eat multiple times. We're eating multiple times a day, unless you're fasting, right? So might as well really put these foods together that can support the immune system. And we only have a couple more minutes here, but I did sort of want to expand just a little bit on a concept that you talked about earlier in terms of the gut, and really how it houses over 70% of our immune cells. And so while we're on the topic of nutrition, I thought maybe tying in some of these foods that we can incorporate that are really can be supportive of gut health and therefore immune health. So I just want to sort of list some of them really quickly. And I know that you are often using soil-based probiotics in practice, but a soil-based probiotic can be wonderful. Also incorporating fermented foods, right? Things like sauerkraut, fermented veggies, bone broth, or if you're eating low FODMAP, then you can do sort of meat broth. And bone broth provides amino acids that are really nourishing to that gut lining. And then something that's sort of on the top of my mind, just because I made it yesterday, was a homemade Jello, and that's a fun thing that I can have and I can share with my daughter, that we made just from grass-fed gelatin, right? Gelatin is it's going to provide the same amino acids that we find in bone broth. It's just in a different dried cooked form, right? Gelatin, and we can make Jello easily. And I use that with a 100% pomegranate juice, right? So there's antioxidants there, and the Jello is really sort of gut supportive food. And then another food that would be easy, and I'm a mom, right? So I'm thinking of all of these sort of family foods, but I was thinking applesauce, like homemade applesauce, where you can really get that sort of apple pectin, right? That is wonderful for the gut. And it's so easy to make. You just throw apples in a crock pot, core them out, throw them in a crock pot. And when it's done cooking, you just sort of blend them up, and it's that easy. It's so quick. And I can actually add collagen powder to that. And that's also a food that's really supportive of the gut. And then, we also have just non-starchy veggies, getting in fiber-rich veggies, right? So things like broccoli and mushrooms and Brussels sprouts. These are all wonderful additions to the diet that will really be supportive of your gut, and just supplying the body with those phytonutrients that, Dr. Chad, you're sort of connecting with us, connecting that to metabolic syndrome for us, which is just sort of amazing to hear, because it's all connected. It's all intertwined, right?
It sure is. Yeah. That's a really good summary of how to make food choices, how to like build a meal. So yeah, that's a great summary of those food choices.
Awesome. So, all right, in the last couple of minutes, is there anything else that you are wanting to add here? Any other concepts in terms of connecting our client population, with metabolic syndrome to COVID-19, and how that sort of affects the way that they are going to be a likely host or a healthy host?
Yeah, I mean, maybe just summarizing what we talked about. So you just talked about all these great foods. So that's the kind of what to eat. And then we talked about the when to eat. Like I said, 50% of the population is consuming food for 15 hours plus per day. So they might just start with a 12-hour window, 8 a.m. to 8 p.m. Boom, start with 12. We think for most people, it's better to compress that to 10 hours, but you can do that over a period of time, but start with 12. So that's the when to eat component. And we know that has a lot of influence on the circadian sort of day-nighttime cycle, which clearly influences the immune system. And then you mentioned, some lifestyle factors like getting proper UV exposure for the morning hours, and then at night having more dimly lit environment, turn the screen off, no food or drink past, you can have water or tea or something, but no alcohol and no food, a couple, 2-3 hours before bedtime. That has a major influence on the quality and depth of your sleep, which is so important for the immune system. Then just sleep itself. try to come up with a routine. That's what the sleep experts tend to say is try to go to bed around the same time each night. And the body just gets used to and starts shutting down the engines on just a habitual basis so that the body is really prepared for that nighttime. So if you include all three of those basic concepts, was kind of some subcategories that we talked about, but those are the three basic ones. What and when to eat, the lifestyle stuff with sun exposure, which is also a great like stress management, because maybe you go out and get the sun exposure while you're on a walk or a bike ride, and then you're kind of getting multiple great aspects at the same time. And then just really emphasizing sleep as just like that Swiss Army knife. Just doing those three things, not only will it help to decrease a person's chance of developing metabolic syndrome, but from a timely issue, so great for the immune system as well.
Yeah, well, wonderful. Thank you so much for all of your wisdom today, Chad. It was so fun to just interview you and to get this information out to our viewers. And we're going to be doing, you know, more and more of these Q&A style vlogs, right? Where you're going to hear from all the experts in our team on different topics. And if you want more information on how to support your immune system, we have an entire free guide. It's called Invest in Your Immunity, and you can find it here on our website, adaptology.health. So please check it out. It's a free guide that we created just to support our viewers and support our community. So Chad, thanks again so much for your time today.
It's great to see you, and I look forward to talking to you again soon.
All right, take care.